Hi, I'm Dr. Charlie Schuster. I'm going to go over, for the sake of our patients today, some things that we talk about in Back to Health are mobility before stability. You're going to hear me say that when you look through these videos. And today we're going to talk about neck mobility. So I want to first off say that one of the best tools you can use for all of your muscles is called the stick. And if you have one of these sticks, this is the professional one. It's longer. It's a little more versatile. There's a shorter one that's a travel stick. You can go on stick.net. We have them in our clinic for our patients, and these are handy. We keep one under each couch at home, under 2 different couches, and we try to always have access to this stick because it helps us manage our muscles and keep them clean so that they can function the way they're supposed to. We have a pretty active family, and it really helps. So for our patients, we want to talk about using the stick for neck today. So if you are at home and you have a bed, and a mattress, and a box spring, and this will be our bed, or it could be your couch. You can be very innovative. I'm just going to put this in between the box spring and the mattress, and I'm going to come in and we're going to first clean out some of the cobwebs first before I stretch, because stretching is, as it turns out, pretty inefficient, especially if you have trigger points in your muscles. So I'm going to get in and I'm trying to find some of the sore areas in my trap muscle. You're not going to want to go over bone. I don't know that I need to say that because the first time you do, you're not going to feel very comfortable. And what you want to do is you want to find the sore areas in the muscle. And I'm going to go up into the neck real lightly at first, and then I'm going to go to tolerance. And I found a couple of areas right in through here. And when I find those areas, I'm going to go over them for about 10 to 15 seconds. So 1 1,000, 2 1,000 to 10, okay? And so once I hit those areas that are sore, all through this trapped muscle here of the neck, because it goes up into the neck, I'm also going to stretch them. So stretching, you want to shorten a muscle, push down, and then stretch. This is like active release to yourself, and that's a technique that lots of the top trainers use on athletes, and you can do this at home and with yourself in such a way that it's not rocket science. When you push down on a sore area and you lengthen the muscle, you'll feel a very immediate stretch in the area. So let's say you don't have a stick at home, you don't have the 40 or 50 bucks, you haven't gotten one. You can use a baseball, and you can do this a couple ways, but first of all, you just want to find the area, push where it's sore, and instead of rolling, you're just going to go back and forth like this. That's one way to loosen up the muscles. And then it's important too to activate the muscles. So you're going to put your thumb up, keep your arm straight, and come up as high as you can when you get on a sore area. And I'm going to find a spot right here, right in the corner of where the shoulder muscles become neck muscles. And I'm going to find it by turning my head and exposing the muscle. And I'm going to go 10 times over that. And I'm going to check all the areas around here. And I'm going to find another one right there, and I'll do 10 there as well. Okay, so I'm just going to go up and back 10 times, and I'm feeling those muscles activate and move under the pressure of the ball. And pretty cheap way to do it. This old baseball, it really is a baseball, works really well. When the neck is loosened and these muscles are loosened around the neck, we want to do some range of motion exercises. So this is a good thing, is just rotating your head and tucking your chin. You're going to get what we call coupling movement in the vertebrae of the neck. And you want to do that about 10 times each side. And it's a slow movement of rotation and then tucking, rotating, tucking. And we're getting a complicated movement in the neck and a full range of motion of the joint. We'll do that 10 times each side. So that's what we talk about neck mobility, what we're talking about. The most significant aspect of that is the muscle work ahead of time. So that really lays the groundwork. Other good stretches, I really prefer putting pressure on something and stretching. You may have been shown this one. It's okay, it's just okay. Nothing like putting the pressure, shortening the muscle first, putting pressure on it, and then stretching. That principle works for every muscle in the body. So that's it for neck mobility.